Why did celiac disease diagnostic protocols change historically? Imagine trying to solve a puzzle with missing pieces. That's how diagnosing celiac disease used to feel. Over time, doctors found better ways to put the puzzle together. Early diagnosis mainly depended on watching for symptoms like diarrhea, weight loss, or stomach pain. But these signs are common to many conditions, making diagnosis tricky. Doctors also used blood tests that looked for antibodies like antigliadin antibodies. Unfortunately, these tests weren't very specific or sensitive, so they often missed cases or gave false alarms. In the 1950s, scientists introduced intestinal biopsies. They took small samples from the small intestine, especially the jejunum, to look for damage caused by gluten. This was a big step because it let doctors see the actual harm. The process involved multiple biopsies, one before starting a gluten-free diet, one after the intestine healed, and a final one after gluten was reintroduced. This method was thorough but also invasive and took time. Later, researchers discovered that celiac disease is an autoimmune disorder. They identified genes like HLA-DQ2 and HLA-DQ8 linked to the disease. This led to blood tests that checked for specific antibodies like tissue transglutaminase. These tests were more accurate and less invasive than biopsies. Now, doctors often start with blood tests, and if they're positive, they confirm with a biopsy. Another big change came from realizing that patients need to eat gluten before testing. Many people had started a gluten-free diet before testing, which could hide the disease. To fix this, protocols now include gluten challenges, controlled reintroduction of gluten, so tests can give reliable results. The gluten challenge involves eating a certain amount of gluten daily, usually around 2 slices of bread or about 10 grams, for at least 6 to 8 weeks. This ensures the immune response is active enough to be detected. The cost of this process can be around $50 to $100, and it requires careful planning. These protocol shifts mean diagnosis is now more accurate and less invasive. But it also means patients need to understand the importance of gluten consumption before testing. If someone has already gone gluten-free, they might need to restart gluten for a period to get a proper diagnosis. Overall, the evolution from symptom-based diagnosis to blood tests, biopsies, and gluten challenges has made identifying celiac disease clearer. It helps prevent misdiagnosis and ensures people get the right treatment. This progress supports better management and long-term health for those living gluten-free.